If you can recall, I think about 2 weeks ago, an article on the news portal Free Malaysia Today revealed that lack of funds is driving some government hospitals to recycle single-use devices at the risk of patient safety. However, MOH come up with a response almost immediately. MOH says that disposable medical devices actually can be safely used up to 3 times, and reusing such equipment would not be unsanitary as it would be cleaned through steam sterilization, and the practice would not involve patients with infectious diseases. However, I think the swift response of MOH is praiseworthy. However, I also noticed that MOH has failed to respond to other allegations in the same article, such as patients are asked to buy medication and have their tests done externally, and also hospital could not repair machinery that have broken down or needed to be serviced due to financial constraints. So my question is, why is MOH not responding to this allegation? Is it because these allegations are cold hard facts and therefore undeniable? I have actually received similar feedbacks on Facebook. A mother said that she was asked to bring her child to do dental x-ray externally as the hospital's x-ray machine has broken down for almost 3 months. Okay, and a HSA patient was asked. HSA is Hospital Sultanah Aminah in JB, yeah. And a HSA patient was asked to go to HSI Hospital Sultan Ibrahim to do a bone scan as the machine in HSA has broke down since 2014. Okay. And the appointment date he got for the bone scan in HSI is October 17, 2018. Yes, a year later. Okay. Not only that, a patient could not get his calcium supply from the hospital 3 months ago, even though he has been taking calcium from the government hospital for the past 9 years. So I think it is no longer a secret that budget for pharmacy and supplies have been reduced recently. But actually, this is not always the case. In between 2010 and 2014, the budget for medicine was increased by at least 10% yearly. Okay, but starting from 2015, you can see from the chart, the budget for buying medicines was reduced despite the spike in patients using government healthcare due to an increase in the cost of living. So I give you a chart here, starting from the year 2009, where the jumlah perbelanjahan for the pharmacy and supply actually was 1.4 B. It actually increased yearly, 2010, 2011, 2012, 2013 until 2014. Every year increased by nearly 10%, sometimes even close to 15%. But however, starting from the year 2015, you can see that the budget for the pharmacy and supply for the medicine doesn't increase, it doesn't maintain the same, but actually reduced by the first year 2.5%, thereafter is almost is 9%, and last year was almost 4%. It is ironic that the implementation of GST also started in April 2015. So, despite that, the end government must explain why, despite collecting more and more tax from GST, they are not able to provide better healthcare to the people. And again, this actually proves the statement by Pakatan Harapan that GST is not going to save the country. If we are not able to combat corruptions, GST is not going to save the country, because you can see that despite the fact that GST is helping the government to collect more and more taxes from the people, but budget for the medicine supply in the government hospital, instead of it being increased, it actually has been reduced. And this all shows that if there is no financial reform, or there is no drastic reform in combating corruption, I think the government hospital services the queue is going to get longer, and the quality is going to be lower and lower. Okay, any questions for you? Okay, ada soalan tak? Tak ada? Okay, thank you very much.